Time now for a segment brought to you by Marquis Health Consulting. Elmhurst Rehabilitation and Healthcare Center is proud to introduce a whole new level of post-acute care to Providence and the greater Rhode Island area, with primary goal of returning patients home as soon as possible. I recently stopped by there to learn more.
I was hired here at Marquis Health to be the Regional Director of Specialty Programs to roll out these specialty programs across New England. Specialty programs like heart failure, congestive heart failure, chronic obstructive lung disease, cardiopulmonary disease, orthopedics, etc.
Marquis Health own and operate 55 facilities across New England.
Specialty programs really look at the entire disease entity from the time a patient arrives, pre-admission, through the continuum of care, right up until discharge and post-discharge. We teach patients how to live with their disease so that they understand the signs and symptoms of exacerbation that usually send them to their community hospital emergency rooms. These programs teach them how to live with the disease, recognize those symptoms, and call their primary care provider for intervention, preventing that readmission. What Marquis Health did is they partnered with the American Heart Association, which is an industry expert in heart disease and heart failure. And we did this because we wanted to be recognized as an industry expert ourselves. So we partnered with the American Heart Association on this program, which actually has a rigorous training and education for staff. We have to demonstrate adoption of their 6 standards and substandards of the program. We have to have the program managed and overseen by a physician, a specialist, and then we have to go through a certification evaluation process by the American Heart Association that really ensures that the entire program has been adopted by the organization.
Your top-to-bottom care starts immediately when you enter the program.
What starts out when the patient gets admitted, they receive an education folder regarding their heart disease. That folder includes tools such as this. It's the Zone tool, which teaches them, just like you would a stoplight, what's good is green, yellow is caution, stop, call your provider, red would be you need to go to the emergency room. They're taught about diet, they're taught about exercise, they're taught about recognizing when activity increases the shortness of breath so that they can pause and regain their composure to prevent that acute exacerbation.
Data shows that heart issues are the #1 cause of readmission to a hospital across the country.
We know that the variance to that is a lack of education to patients and families around their chronic disease management, or lack of access to post-acute care, medications, scheduled visits. The rigorous training that the staff go through for this program teaches patients how to deal with their disease in its entirety. And then we follow up with that patient post-discharge. We want to make sure that the individualized plan that we put in place to keep them healthy and home is actually maintained. Marquis Health is an industry leader in the subacute space. They really have invested deeply in specialty programs because they see that we're taking care of a sicker, more aging patient population that's living with chronic disease. And because of their investment in specialty programs, I can tell you that the readmission rates across Marquis are steadily dropping. And that is phenomenal. We have not seen that in the history of the treatment of our patients with these diseases in many, many years. So kudos to Marquis for stepping up and really leading the charge in the subacute space.
Now, Elmhurst adheres to a patient-centered care model that emphasizes choice, quality of life, and personal dignity. This segment was brought to you by Marquis Health Consulting. We're going to post a link to them on our website, rhodeshow.com.